It's Friday, May 27th, 2011 at 1:52 a.m. So yesterday I went to have my pre-op consult with the surgeon, Dr. Hollis, and I was pretty pissed because they told me it's going to be at 1:30. So I took off from work and at 12 because my work is about 45 minutes away from the office because I work in Cypress, which is the north. If you're in Houston, I work in Cypress, and then the office is in the medical center. So it's a 45-minute drive. So I get there. I'm early because I have anxiety about being late all the time. So I get there, sign in. It's about 1:10, and I wait and I wait and I wait and I wait. He didn't see me until 5. Yeah, until 5. So I was sitting on my butt for 4 hours being bored. Good thing I brought my iPad, and my phone my phone died by the time it was time to go, but good thing I was entertained a little, and then Ellen was on TV, so yeah. But when we did, I'm very glad that there is that pre-op session. He explained the whole process step by step by step. And one thing he said was that he automatically fills you during your surgery. He fills the band. So we don't wait a month to get a fill, or however long it is that people usually wait to get a fill. He fills you that day. And then in a month, he gives you another fill. So I thought that was pretty interesting. And also, he was talking about the gas pain, how I know everybody's saying that they have gas pain. And he was saying that usually surgeons put your arms out like this during surgery, but he puts your arms down like this at an angle, and that it should lower your gas pain. And that with his patients, he's been doing this number for the past year, and that it's helped reduce the gas pain significantly. I was like, oh, okay, cool. And then he also mentioned that he kept going, I don't know, maybe he's crazy, I don't know, but he kept going on and on that some of the lap band stuff is outdated, and that the book that the original guy put out, Dr. O'Brien, that he put out is old, that it's 10 years old. Right here. I guess. Maybe not 10. But, yeah. And that I don't know. But he said that most of his patients are very successful. And, of course, aren't all doctors going to say that? Most of my patients are very successful. And it wasn't a one-to-one meeting. It was a meeting. It was me and 3 other women. They were older than me, probably in their 30s. And one of them, oh my god, all of them were kind of a little annoying me. One of them that was sitting next to me claimed to know everything and, all things lap band. And she was kind of talking down to the other ladies, and it kind of annoyed me. The lady that was sitting next to her, she has the same surgery date as me, and she was saying that she had been watching a lot of YouTube videos, and I was like, oh yeah, me too. And then we were talking about the other lady at the end. She was, I wonder if you can wear a two-piece swimsuit. And I'm like, lady, you are 40 years old. Nobody's going to want to see you in a two-piece swimsuit. And I think your body isn't, I mean, the lap band does, is slower than the gastric. But I think people still have a little bit of loose skin, some loose skin. And I don't think she could wear a two-piece swimsuit without having plastic surgery. And then she was, her main concern were the scars, and if she could eat pasta. And I'm in a big Italian family. Am I going to be able to eat that? And it was kind of annoying. Like, I don't know. It seemed like one of those people. I don't want to seem negative, but she just seemed like one of those people that is not going to be too successful with the band, or is going to hate the band, and it's going to say my band doesn't work, or something like that. Because she was saying, I love my pasta. I can't live without my pasta. And she still hadn't gone through the pre-op diet because her date is on the 22nd of June. So she still hadn't started her pre-op diet. And a lot of people, I think that a lot of people are not well informed about the band and what it can do for you if you use it the correct way. And she was one of them. And then that other lady that kept on saying that she knew everything about it, we were having like a debate between how many incisions there was going to be, and I was like, I think there's 5. And then the other lady agreed with me, the one that had the same surgery did as me. She's like, yeah, it's 5. I've seen a lot of videos. And then the girl goes, the woman next to me, she's like, well, how dated are those videos you guys have been watching? And because she said that it was 3 incisions. And I was like, they're pretty recent. And then she's like, well, I researched a lot and it was 3. And then right when the questions and answer portion, after the doctor had already talked, she was like, how many incisions is it? And he said 5. And I was like, yeah, I was right. Because she was annoying me. She was so annoying. I don't like those type of people that are just like, I'm right. Okay, if you're right, cool. If you're not right, just shut up. But yeah. So I hadn't had a BM in about 3 days. And I realized it was because I hadn't had enough fiber. So I got some fiber gummies. And I wonder if those go down well after surgery. I don't know. I might have to like chew them forever and ever. Other than that, I'm so mad because tomorrow is the last day that my primary care doctor can send my my clearance. That's the only thing I need. I have everything else. And so I have the day off tomorrow. Well, today was my last day. And I'm like, I will go to the Woodlands, which is kind of far from my house, to see my primary care doctor to make her do it, because I had called like 4 times already in the past 2 weeks, and she still hasn't sent it. So I called today, and I told her, because, okay, when you call the doctor's office, do you get the receptionist? Well, the options are the receptionist, the medical assistant, or if you're a physician. So I had been leaving messages for the medical assistant, but nobody had been returning my calls. She hadn't sent the clearance, and so I got kind of pissed, and I was like, come on now, like, tomorrow is my last day to send in my clearance, and I don't think I sounded too pissed off on the phone with the receptionist that takes the appointments. But I was like, oh my god, you know, this, I couldn't stop talking for like about 5 minutes about it. And she's like, okay, I'm going to email her and email the medical assistant, email the doctor and the medical assistant directly and put high priority. I was like, thank you, thank God, and I will call tomorrow and double check. And I know her office is open until 5. She sees people until 5. So I'm hoping that she clears me, because I do not want to reschedule my surgery, because I kind of want to be in the mushy stage by the time my best friend gets married, and she's getting married on the 26th or 27th, one of those days, that Saturday of that week, and I want to be able to look somewhat normal, be okay, not just be on liquids, because I don't know, that was just my plan, and that's what I want to keep. And so it's important to me, because I'm already ready for this. I'm ready to take this leap. You know, Wednesday is so close, and I need it to happen. And so it's very frustrating. And I don't know, but the reason they, I mean, I might just, you know, be causing a whole big trouble for my primary care doctor, because I think they need clearance for my liver, which I did visit my gastro doctor. No, I'm not going to try to pronounce that. Yeah, I'm not. And I also called him and told his nurse that I needed that, and that if he could please do it. And he said, yeah, I'll talk to the doctor about it, because I spoke to him directly. I called today, but I called after work, and after 3 they send all calls to the answering machine or whatever. So I left him a message. They still hadn't sent the clearance from there either. So I'm like, oh my god, who am I supposed to track down to get this done? But yeah, I got a lot of things to do tomorrow, a lot of people to track down, a lot of things to do, and I mean, I guess not a lot of things to do, but it's a major thing to do that I need to do, because I need this to happen. Yeah, but that's it for now. I didn't weigh myself, sorry. But I have been keeping up with my diet, that's for sure. Oh, today was my last day of work, and the kids were only there for half a day, and the hour afterwards was one of my coworkers' baby showers, and they brought so much food. It was like 15 boxes of, I mean, maybe I'm exaggerating, but a good 15 boxes of pizza, meatballs, chicken salad sandwiches, dips, chips, sodas, cookies, brownies, cupcakes, whatever you could possibly want to eat, it was there. And I watched all my coworkers eat, and I didn't touch a thing, and I felt very proud of myself, but it was so hard. I was like, oh my god, that pizza looks so good. I want that cupcake, but yeah, I stayed away.